I spent the last 10 years doing primarily basic science research, and 10 years of research convinced me that ketones and ketone metabolic therapy has profound implications beyond epilepsy. And really, where the rubber meets the road, so to speak, is the art and the science of implementing these approaches. And I really want to commend the people who do that. I was inspired by Jeff Volek's book, The Art and Science of Low-Carb Performance, Low-Carb Living, and really want to give credit to the dietitians that are in the trenches in the field, especially Beth, that's kind of making these dietary therapies and the different versions of the ketogenic diet possible. And also more recently, my collaborator, Dr. Allison Hull, now part of USF, and really I've watched her and her interaction with the patients and being able to get them working together to help each other in different platforms and through her education. And I've realized that we can overcome many of the challenges in implementing this with the right approaches. So with that in mind, I think there are many different ways to implement what I want to call ketone metabolic therapy, or as therapeutic ketosis. And we know that ketogenic diets, by virtue of suppressing insulin signaling and lowering glucose and glycolytic activity, can induce hyperketonemia, and that this can elevate ketone bodies, beta-hydroxybutyrate, acetoacetate, which we found has profound anti-seizure effects with beta-hydroxybutyrate and acetone. And the good thing about these approaches are that there are commercially available technologies that can allow us to precisely measure ketones in the blood and in the breath. And I think that's going to be really important moving forward, because as we individualize these dietary therapies or supplement therapies, we may need to titrate them in a way to achieve therapeutic ketosis individually for each patient. And we also know that there's profound signaling effects. So the first couple slides I eliminated because you guys are convinced at this point that metabolic therapies, including ketones, have profound effects on mitochondrial function. Many of these things, we study in the lab. Reactive oxygen species production. Back in 2007 and 2008, I was looking at the work of Dr. Jong Rowe showing that beta-hydroxybutyrate can reduce reactive oxygen species. And that's really a sign that the mitochondria is working more efficiently. We also do, a lot of people know me as the keto guy, but we do research with hyperbaric oxygen therapy. We've published studies on metformin. We're doing glycolytic inhibitors like 2-deoxyglucose and lonidamine, for example. But we always come back to ketone metabolic therapy because it works the best. So it works when drugs fail. We tried using various anti-seizure drugs for oxygen toxicity seizures, and therapeutic ketosis works better than any drug, even very high concentrations of things like vigabatrin. So this really motivated me early on to steer the direction of my research from drug research to looking at the ketogenic diet, but developing methods to induce therapeutic ketosis. And there are it's many different mechanisms really working in synergy to produce these effects. And there are a variety of different ketogenic agents that can circumvent the dietary restrictions needed to achieve ketosis. And this is important because we have great dietitians in the field and different variations of ketogenic diets that are more easy to implement, but there are people that are unwilling or unable to follow the ketogenic diet. So this is the reality. We see it in the world of epilepsy. So we're going to need strategies that can produce therapeutic ketosis in a way that can meet the dietary needs of the patient. So some patients are very adamant that they want to follow a vegan diet or vegetarian diet. It's a little bit easier, or a Mediterranean diet that's not ketogenic. But with the use of ketone metabolic therapy in the form of ketogenic fats like medium chain triglycerides, also ketone electrolytes, ketone salts, we can combine beta-hydroxybutyrate with sodium, potassium, magnesium, calcium. And then there's ketone esters. There's a variety of different esters on the market. We work with our chemistry department, and we have a library of 60 different ketogenic compounds. And many of these ketogenic agents are extremely potent in our lab. We have not published the research yet, but we are screening a wide variety of ketogenic agents that are capable of inducing ketosis. Many of them we've already put into mouse models, and they seem to be safe. They seem to be highly effective. The last one, I don't have data on it, is a glycerol triester of acetoacetate, but interestingly, it also elevates beta-hydroxybutyrate in a 1-to-1 combination, so a glycerol triester. So there's many different things, ketogenic agents in the pipeline, and I think it's probably going to be a combination of a variation of a ketogenic diet that the patient will actually follow, and then we can further augment the therapeutic efficacy of the ketogenic diet with various formulations of ketogenic compounds, and that could be an ester, ketone salts, and then we find that medium chain triglycerides added to a ketone ester or ketone salt increases the therapeutic efficacy in pretty much every disease model we look at, including anxiety, several seizure models, even like things like lowering glucose. And it also shifts the pharmacokinetic curve because fat slows the digestion. So if you administer an exogenous ketone with a fat, like medium chain triglycerides, you get a better sustainment of ketosis over a longer period of time. And then the MCTs also may have effects in and of themselves. So they can cross the blood-brain barrier and be directly used by the mitochondria in the brain. So we did a study, we have not published it yet, we're sitting on the data, but we administer MCT and then we take out the hippocampus and we find the MCTs are making it into the hippocampus and they play an important role in generating energy. So I don't need to convince you of that ketones can stabilize and enhance and preserve brain energy metabolism, even in the face of glucose impairment or glucose hypometabolism. And it's doing that probably in different disease models. We know with GLUT1, glucose transporter type 1 deficiency syndrome, that you can circumvent the impairment of glucose transport. In conditions like traumatic brain injury or Alzheimer's disease, there may be a deficiency or a decrease in the translocation of the GLUT3 transporter, and that could be a problem. And also pyruvate dehydrogenase complex may be deficient or impaired in various diseases, and I suspect in psychiatric diseases. So ketones, elevating ketones by virtue of a diet therapy, MCTs or exogenous ketones can produce hyperketonemia and circumvent the impairment of glucose metabolism and ATP production. And on the left here, we have a normal brain and an Alzheimer's brain and FDG PET scan. And Alzheimer's disease, a hallmark characteristic of Alzheimer's disease is glucose hypometabolism. And also this is a hallmark characteristic of depression. And I suspect this is the same scenario with psychiatric diseases. So shifting gears a little bit to our current study, really spearheaded by Dr. Allison Hall here, who's a speaker at MHS. So I'm plugging MHS, the next conference we're going to. So we have a clinical trial in progress, very preliminary results with the first cohort. We are looking at glycemic variability and looking at continuous glucose monitoring, which I think would be really important for any trials that develop out of here, including continuous ketone monitoring, which is now available, and also continuous, it seems from the discussion, continuous lactate monitoring, which is also, we measure lactate in a lot of our disease models, including cancer models. So continuous lactate, ketone, and glucose monitoring would be super moving on to clinical trials. But with continuous glucose monitoring, we're asking the question, can we influence behavior with the use of CGM, and can that behavior enhance metabolic outcomes, enhance behavioral outcomes? So we have some preliminary data. The data that seems most interesting and compelling is actually the data with GAD7, PHQ-9, and PSQI, looking at sleep. And then Allison also has her own sort of wellness score for mood, which is also increasing. So increase in that case is a positive effect, and we see a decrease in scores of anxiety, decrease in the PHQ-9, and an increase in sleep. So moving forward, and we want to thank the Baszuckis for sponsoring the second cohort, where we're going to further expand on the psych data and also helping us do statistics on the cohort 2. So stories are so important, and I added this at the last moment. This is a case report that we recently published with a patient that reached out to me back in 2015 or 16, And he had chronic obstructive pulmonary disease, and he was told that he would need a double lung transplant in 5 years, and he was only 45 years old at the time, and mental illness was something that he dealt with. And he started the ketogenic diet, and he felt a profound sense of calmness that he hasn't felt ever. And he was a patient with chronic obstructive pulmonary disease, but we published this case report in collaboration with Dr. Peter Barnes, who is like the icon in respiratory physiology and someone whose publications I read when I was an undergrad in grad school. He's in Imperial College London. So we gave him the data, and he was super excited about the data. Russell, who is also author on the manuscript, runs marathons. So we saw a profound decrease in things like CRP, TNF alpha, IL-1 beta, and IL-6, and he has, despite what they tell you with chronic obstructive pulmonary disease, he actually increases FEV1, which is really remarkable. And most importantly, from his perspective in communicating, we didn't really talk about this in the case report, but his mental health increased profoundly. And I think that this is just another expanding application of the ketogenic diet. I never thought I would go down the road of chronic obstructive pulmonary disease, but there are so many different applications to this metabolic therapy. And before I end, I really want to give credit and thanks to the Baszuckis again for making this possible, but also the people that actually do the work in the lab, including all my graduate students, medical students, undergraduate students, my wife, who's a behavioral neuroscientist, did a lot of work at the hyperbaric lab. And also we have a research collaborator in Hungary who did a lot of mechanistic work looking at the effects of adenosine signaling. So with that, I want to conclude and thank you all for your attention.